HIV cases in Alberta at a shocking rate, according to a new Alberta Health report. The report showing a 73% increase in HIV cases in 2023 compared to 2022. The annual report reveals the number of new HIV cases rising from 293 in 2022 to 507 in 2023.
The number of new to us patients continues to rise, and it's well above the historic numbers for the last 20 years.
According to the report, most of the cases, 54.8%, were acquired out of the country compared to 43% in 2022.
Migrants from other countries do at times find it difficult to connect, and maybe to improve the connectivity after someone lands at Edmonton International Airport, to be aware of the Northern Alberta HIV program. This is where you go. This is how care is delivered.
It could be immigrants. We've also seen cases of people who have traveled outside the country and have returned, to test HIV positive.
According to the report, the second most common category of exposure in 2023, accounting for 18.5% of new cases, was transmission between heterosexual partners.
Heterosexual transmission is not necessarily consensual transmission. And yes, we certainly have a large number of heterosexuals now, usually from migrant countries. Not
only doctors, but also frontline agencies are seeing the impact of the rising numbers in HIV cases. SafeLink Alberta saying more health education is needed.
It reminds us of a need for a more holistic approach to education and awareness on prevention, breaking down the barriers and the stigmas around accessing support services.
In an email to City News, Alberta Health saying the government continues to work with Alberta Health Services and community-based organizations to improve health, reduce barriers to sexually transmitted and blood-borne infections testing and treatment, and increase access to screening. Adding the number of HIV cases in 2024 have not been finalized. However, cases are on track to be similar to what was reported in 2023.
The government of Alberta needs to be, pumping more resources into STBBI testing and treatment to respond to the influx of cases.
In Edmonton, Hiba Kamal-Choufi, City News.